What is occupational therapy? Occupational therapy is a client-centered health and rehabilitation profession concerned with promoting health and well-being through occupation. The profession views occupation as everyday activities in which people engage. These can be divided into the areas of self-care, work, and play or leisure. The primary goal of occupational therapy is to enable people to participate in the activities of everyday life. Occupational therapists achieve this outcome by working with people and communities to enhance their ability to engage in the occupations they want to, need to, or are expected to do, or by modifying the occupation or the environment to better support their occupational engagement. We aim to increase independence, enhance development, and/or prevent disability. Occupational therapy, or OT, comprises the use of assessment and intervention to develop, recover, or maintain the meaningful activities or occupations of individuals, groups, or communities. Occupational therapy is a regulated health profession and requires specific university training which complies with national and international standards. Occupational therapy is a 4-year honours degree which qualifies you to work in any of the various fields. These fields include children and youth, health and wellness, mental health, productive aging, visual impairment, adult rehabilitation, travel occupational therapy, work and industry, occupational justice, and community-based therapy. What is the role of occupational therapy in pediatrics? Occupational therapy in children and youth aims to assist children in improving their cognitive, physical, sensory, and motor skills and enhancing their self-esteem and sense of accomplishment. A child's main occupation is playing and learning, and occupational therapists can evaluate the skills for playing, school performance, and daily activities and compare them with what is developmentally appropriate for that age group. Children who might need occupational therapy include, but are not limited to, the following: birth injuries or birth defects, sensory processing disorders, traumatic injuries, learning problems, autism or pervasive developmental disorders, juvenile rheumatoid arthritis, mental health or behavioral problems, broken bones or other orthopedic injuries, developmental delays, post-surgical conditions, burns, spina bifida, traumatic amputations, cancer, severe hand injuries, and multiple sclerosis, cerebral palsy, and other chronic illnesses. The role of occupational therapy in pediatrics generally involves promoting independence in activities of daily living, improving visual motor skills and eye-hand coordination, developing balance, movement, and coordination, improving handwriting, supporting sensory processing and regulation for attention and concentration, improving planning and organization skills, recommending adaptations or specialized equipment for home and/or school to improve participation, and providing specialized seating or wheelchairs. A pediatric assessment evaluates the component areas involved in the performance of daily activities. These include sensory, which is the child's ability to interpret and organize information from the senses about their body and environment; motor, which refers to the child's tone and strength, patterns of movement, posture, gross and fine motor function, and hand-eye coordination; cognitive, which is the child's arousal level and attention skills, initiation and planning of activity, problem solving and safety awareness; and psychosocial, the child's self-esteem, motivation, and social interaction. Pediatric occupational therapy helps children with different needs develop skills to perform the purposeful activities that make up everyday life. It aims to help children be as independent as possible in their everyday lives. What does the occupational therapy process involve? Firstly, the occupational therapist will carry out a screening and/or assessment. This may take place over 1 or 2 sessions, and it often includes parent and child interview, parent and teacher questionnaires, standardized and non-standardized assessments, and play-based clinical observations. A brief occupational therapy report will be provided to the parents and referrer. The therapist will work with the child, their parents, and their school to develop meaningful goals for occupational therapy intervention. Intervention may include the following: one-on-one occupational therapy sessions, group therapy, home and/or school visits, individual home and school occupational therapy programs. Further training in the field of pediatrics. Occupational therapists working in the field of pediatrics may go on to acquire additional knowledge or expertise in specific areas. Most common are the areas of sensory integration, also known as SI, and neurodevelopmental treatment, or NDT. Sensory integration refers to the process where the brain organizes and interprets information received through the senses, namely touch, movement, body awareness, sight, sound, smell, taste, and the pull of gravity. Sensory integration therapy aims to help children with difficulties by exposing them to sensory stimulation in a structured, repetitive way. The theory behind it is that over time the brain will adapt and allow children to process and react to sensations more efficiently. Through fun and play-based activities, OTs attempt to change how the brain reacts to touch, sound, sight, and movement. Sensory integration therapy should be provided by a specially trained occupational therapist following a thorough evaluation of whether your child would benefit from SI therapy. Sensory integration provides a crucial foundation for later, more complex learning and behavior. Sensory processing disorder is common in diagnoses of autism spectrum disorder and attention deficit hyperactivity disorder, amongst others. Sensory integration training consists of 4 training courses with submission requirements after each level. The course is generally completed over 3 or 4 years. There are 4 intensive consecutive courses that consist of theory, test administration, interpretation, and intervention. The post-course requirements include a post-course questionnaire that must be completed and passed, a peer-reviewed administration of the SIPT on 5 cases with extensive testing on 1 case, submission of a case and write-up of a protocol demonstrating clinical reasoning competencies of interpretation. This includes test administration, scoring, diagnostics, and approach to treatment, and a treatment video demonstrating the use of ASI. Sensory integration and the Sensory Integration Praxis Test is one of the more intensive certifications. This is offered through the South African Institute for Sensory Integration. Neurodevelopmental treatment, or NDT, is another of the more intensive certifications commonly obtained in the field of pediatrics. This is a hands-on treatment approach used by physical therapists, occupational therapists, and speech-language pathologists to enhance the function of adults and children who have difficulty controlling movement as a result of neurological challenges, such as cerebral palsy, stroke, and head injury. Children that may benefit from NDT have diagnoses that would include, but are not limited to, all types of cerebral palsy, individuals with pathophysiology of the central nervous system, insults at and around birth, hydrocephaly, genetic syndromes, Down syndrome, hypotonia or hypertonia, preterm birth, or abnormal movement development. Therapists trained in NDT have completed advanced training that enables them to properly assess and treat the variety of neuromotor problems experienced by these individuals and help these individuals become as functional and independent as possible. NDT training is conducted through the South African Neurodevelopmental Therapy Association, or SANTA. The basic course is open to qualified physiotherapists, occupational therapists, or speech-language therapists with at least 2 years full-time or equivalent postgraduate experience in the treatment of children with cerebral palsy. It is an intensive full-time course presented at postgraduate level and consists of 8 weeks broken into 2 4-week courses. SANTA also offers 2 levels of advanced courses that are only open to therapists who have successfully completed the basic course. It is important for consumers to ask the therapist when scheduling the appointment about specific training or courses taken to ensure that the parent's goals or expectations are within the scope of the relevant therapist and that the approach utilized is executed safely and correctly. So what is so great about occupational therapy? Occupational therapy is the only profession that helps people across the lifespan to do the things they want to and need to do through the therapeutic use of daily activities or occupations. Occupational therapy practitioners enable people of all ages to live life to its fullest by helping them promote health and prevent or live better with injury, illness, or disability.